Hi, welcome to Healthy Living. This month, the month of November when we're filming, is National Hospice and Palliative Care Month. So here at St. Tammany Health System, we have an excellent hospice and palliative care team, and I brought some of those members with me today to talk about all the things that we have going on, what you can do, how you can get those services, and how you and your family can benefit from what we offer. So my first guest is Emily Puppo.
Well,
Emily's been here before. Thank you, Emily, for coming.
Thanks for having me back.
Yeah, she is our palliative medicine supervisor. Mm-hmm. So tell us first, before we start talking about, getting into the nitty-gritty of palliative care, tell us a little bit about you and what you do for the health system.
Yeah, so I've been with St. Tammany going on 7 years now, but I'm the supervisor of palliative care, as you said, and I supervise nurse practitioners. We have a physician as well, nurses and social workers, and our goal is to just help manage patient symptoms while they're tackling a serious illness. We want them to know they are not alone.
Good. That's a good definition. And when we talk about palliative care, we were talking about this before we came on camera. Mm-hmm. Often people interchange palliative care and hospice, and while we do offer both of those service lines, there is a nuance to each of them that makes them different. So can you talk about that?
Yeah, absolutely. So palliative care and hospice, the difference between the two, the biggest difference is that with palliative care, you can still seek treatment, you can still go to the doctor, you can still go to the emergency room, hospital even, get your chemo, whereas with hospice, the goal is more comfort. Being at home, with your family, you're no longer seeking treatment. You don't want any more chemo, and you just want to be at home with your family. And so that's the biggest difference. But with palliative care, we walk along with you from time of diagnosis to when it's time to hand off to hospice. And then we step back and let the hospice team with their expertise handle the rest.
Gotcha. So we've talked before about how palliative care really is a form of supportive care, and it is for people who have a terminal illness, and it's also for people who have a chronic illness. Right. So can you kind of explain how that works? Why would someone seek palliative care, whether they have a terminal illness diagnosis or a chronic condition that they're living with?
So with a terminal illness, sometimes cancer that's incurable, things like that, and with a chronic illness, or some say life-limiting serious illness, we want patients to know that it doesn't have to be life-limiting,
right,
and it doesn't have to be uncomfortable. So really, with serious illness, chronic conditions, congestive heart failure is an example, COPD, Alzheimer's, dementia, cancers, things like that, we can help manage those symptoms: shortness of breath, anxiety, depression, agitation, cancer-related pain. And our goal is to also offer support for them and the family, help with coping, education on the disease process, and really understand what is to come and help them live a longer life, but have quality with that.
Right. So for instance, my own mother, she has congestive heart failure. She was diagnosed years ago. How would she implement palliative care into her care? Who would she start with?
So we actually have a lot of patients that will just call our clinic and ask us the same question: how do I get in with you guys?
Yeah.
But simply ask her cardiologist or her primary care doctor for a referral. And of course, if they get pushback for any reason, we always tell them to give us a call, and normally it's education. But how we would help her, for example, would be the shortness of breath. Along with shortness of breath comes anxiety. With anxiety comes depression.
Right.
Those are symptoms that we can help with CHF, or congestive heart failure.
Right.
And then there's also edema in the legs, different other symptoms like that. But the anxiety, depression, shortness of breath are the three main ones. But all you have to do is ask your provider. I know St. Tammany Health System has a palliative care, and there are other palliative cares that are conjoined with a hospice,
right,
that aren't with St. Tammany. But I recommend asking your physician, and I also recommend talking with family and friends. A lot of family and friends, know people who know people who know people. Right. So yeah, they'll be able to help as well.
And when you say we can help you with this or that or the other, what do you mean? What is the help?
Yeah. So of course, there's medications. There's medications such as low-dose morphine. Really small low-dose morphine really helps relax the body and has great success with preventing shortness of breath and, and comforting the shortness of breath. And there's other techniques. We teach breathing techniques. We also have a social worker that offers support and how to cope when an attack, for example, a shortness of breath attack or anxiety happens. There's also just education. Whenever you don't know what to expect and the unexpected happens, it makes it worse, right? So whenever you're educated and you know what to expect and what's going to happen, it doesn't make it as bad and as scary.
Right. So Emily is all about continuing education and educating everybody, all of our colleagues, on palliative care, which is so smart. So I watched a couple of videos that you sent me links to last year, and one in particular was a breast cancer survivor. The woman had been living with breast cancer, I want to say like 17 years. But she was a seamstress, and the treatment left her with neuropathy in her fingertips.
Yes.
And her testimony was basically that palliative care allowed her to get back to doing what she loved. So in that instance, that's basically a medication, right?
So with the neuropathy, you know, the nerves in your fingers, there's different medications that can assist with that. There's also, you know, different techniques. There's compression, you know, sleeves for your arms as well. There's a lot of different techniques that can help with that, physical therapy.
Yeah.
And that's kind of our goal. So that patient's goal, for example, was I just want to get back to seamstressing, I guess is the way you say it. But we have patients that have even simpler goals. I just want to be able to walk outside and sit on my porch in my rocking chair without being short of breath. I just want to be able to hold my grandkid and not hurt.
Yeah.
You know, so some people that seems, you know, oh, that's not a big deal. But when it's taken from you, it matters more than anything else. So our goal is to help patients achieve their quality of life and their goals, whatever those are.
Okay, that's good. That's a good way to put it. And that, to me, kind of puts it in a nutshell for people. You have another kind of goal of the care that you provide, and you and I have talked about this a lot, and you call this the best gift that a family member can give to another family member, and that's advanced care planning.
Yes.
So, first of all, why is that important, number one, and then how do you go about it through our palliative care team?
Yes, so perfect timing. So again, this is November, but it will be airing, I'm assuming, around
early, like in the next couple of weeks.
Yeah, the next couple of weeks. So December, so Christmas. So the best gift to give your family is the knowledge of knowing your wishes. So advanced care planning, there's different levels: living wills, healthcare power of attorney, advanced directives, and then a LaPost as well, which is a physician's order for scope of treatment. And these are basically different documents that you can document who you would want to make your medical decisions if you're unable to speak for yourself, if you would want chest compressions, intubation, feeding tube, really spells it out in depth, and then that way there's no guessing. You know, hypothetically your daughter doesn't have to guess, would mom want this? I'm not sure, I don't know, and then they have to live with that decision.
Right.
So this Christmas, you know, maybe give the gift when everyone's opening presents. It's not a fun topic, but you could, you know, hey, if something happens to me, I want you to know what I want so you don't have to worry about it ever again.
Yeah, peace of mind.
Right, peace of mind. And we have plenty of events. We're going to be announcing our 2025 series soon, that we do ACP events every month where we'll complete the documents for free for patients.
Great.
And their families. You know, a lot of times we'll have a spouse, and then all of a sudden the other spouse will be, hey, I'm going to do this too while I'm at this appointment.
Right.
Like, come on. And we're also, our goal is to be in the community. And any doctor you talk to can help you with that, but you can always reach us at Palliative Care as well.
Okay. So let me ask you one last question before I let you go. What is it that you love about what you do?
That's a tough question. There's a lot. So there are tough days, but the tough days are few and far between, and what really makes me love this job is when a patient or a patient's family member, we're in a thankless job, right? As nurses, as healthcare, it's not always we don't always get thanks. And so our thanks is that patients, you know, achieve their goals and get what they need. So when a patient's able to call us and they're able to say, I think I'm ready for hospice now, I feel good about my decision, it makes me so happy I could cry, because they're prepared, we've walked it with them, they trust us, and they're able to say, I'm ready now. And they're able to make that decision, and it's not thrown upon them or scary. And I just love my team as well. You know, each person in palliative care, it's personal to them. I know we've talked about my mom before and how palliative care helped me make those decisions for her, because I was in that situation and we hadn't talked about it before, so I really struggled with that. And just helping patients have a good quality of life, achieve their goals, whatever those goals are, and achieve a good death, whatever that death is. If it's fighting to the end, if it's at home with her grandkids, whatever it is, we just want patients to know we're here for them, we hear them, we're walking the path with them, and we can also help them get to wherever they want to be.
Great. Well, thank you so much. Thanks for sharing all the information, and thanks for sharing your heart with us. Is there anything else you want to add?
I would just like to add that if you aren't sure who to talk to about advanced care planning, just call me. Our number is 985-871-5975.
Okay.
And if you come to the hospital and ask for the girl in palliative care that talks about ACP, everyone will know where to send you.
All right. Thank you, Emily.
Thank you.
And thank you for staying with us. We will be right back with our next guest.
Just this morning, optimism and strength prevailed. Many hopes became reality at St. Tammany Health System, dedicated to more little miracles. And the bigger ones, too. One of many reasons we're number one.
Welcome back to Healthy Living. Like we said at the beginning of the show, November is National Hospice and Palliative Care Month. And so I brought some members of our team from both of those service lines to talk to us today about the services we offer at St. Tammany Health System. So my next guest is Stephanie Atwood.
Hi.
Welcome, Stephanie.
Thank you.
You're welcome. She is a licensed master social worker and our bereavement coordinator with our hospice team. So first, before we start, just tell us a little bit about you and what you do for St. Tammany Health System.
Absolutely. My name is Stephanie Atwood. Like you said, I am a social worker, but I serve as the bereavement coordinator for our hospice program. So with that role, I follow our families for up to 13 months following the death of their loved one.
Oh, wow.
And offer many services that help them through that process.
That's amazing. I had no idea that we had such a close relationship for such a long time.
Yes, absolutely.
With our patients. So I want to ask you, hospice care, it's a very specialized care. You know, it's a special, you have to have a special heart to do that. And thank you for doing what you do. How does hospice care address all of the needs of the families when it is time for someone to enter hospice? There's a lot of, you know, I mean, I myself, I have a large family. So you can imagine all the emotions and the thoughts and the opinions. So what is kind of your role? How do you address the needs of the family and the caregiver and the patient?
And I think you just nailed it right there. It's not, it involves the whole family system. It's the patient and the family. You know, we have that interdisciplinary team that includes our nurses who are meeting with the patient and making sure all of their physical symptoms are managed, as well as our aides. But you have the social workers who are there, who are able to go in and assess for the emotional needs and the anticipatory grief and all of the psychosocial needs, the family dynamic issues. We look at all of that in order to make sure that everyone is as prepared as they can be as we enter or look at this end of life process.
Yeah, because I guess when you do enter hospice, you know that you are at the end of your life, and while you know that, the reality is far different from what your anticipation is.
Absolutely.
So I guess that's your job to kind of manage that expectation.
We help the families continue that process, and the patient as well. Sometimes patients are in denial as well as far as what their disease process is and what the decline may look like. I mean, we're there to continue to support and educate as well. So
we talked about kind of the overall family dynamic and how you're part of that. How do you, when through that 13-month process, why the 13-month follow-up? I know it's logically, it's a simple answer, but just kind of explain it in your words.
For the bereavement program for 13 months, grief is is a lifelong journey. Really, 13 months in the scheme of things is not really long enough if you think about it.
Right.
Within those first few months, you're still just processing everything that's happened, from a diagnosis of a terminal illness to the decision to enter hospice care. And as a caregiver, watching your family member decline and ultimately pass. It's a lot to process. So in that 13 months, we're there to do individual grief sessions if needed.
Right.
We have grief support groups as well.
Oh, wow.
Caregiver support groups as well too, for those caregivers who are involved at that moment in the caregiving of their loved ones. But you need the 13 months. I mean, we don't know. 1 month versus 6 months looks totally different.
Yeah. So how would someone, if they wanted to participate in a grief support group, what would be the process?
All they need to do is call me. They can reach me at 985-871-5746, and I can give them the information on the grief support groups. We have 2 in Covington and 1 in the Slidell area as well.
Okay. So we talk about how, you know, grief is, it's just a journey. It's like the next part of the journey in your life. So how do you, I guess, how do you walk people through that? You know?
I think the most important thing with grief is to allow people to talk about their person. You know, the more that we can talk about them, the more the connection that we hold with them. It's important. It's part of who they are.
Yeah.
So giving them that space to do that is important, and also stressing to them that it's unique. Their grief is not going to look like anybody else's.
Exactly. It's personal.
It's very personal. It's really like a fingerprint. You're never going to find anybody else's grief that looks like yours.
Yeah. So I would imagine that through your work, you really do get close to the families that you work with. Yeah. And so what does that mean for you, like as a caregiver?
I look at that as the biggest blessing and gift that I'm meeting people in their most intimate, crisis-filled moments.
Right.
And I'm being blessed by being able to be there to help them through their journey. They're blessing me.
Oh, that's wonderful. So, so why did you choose this line of work?
You know, from having had loss and personally, and not really knowing what grief was supposed to look like, and then going through it, I wanted to be able to be there to support others as they found their way through it. It can be a very lonely feeling.
Right.
And to know that somebody really truly cares, it helps. I mean, people need that.
So if you were talking to, I know there's no, like you said, and I agree with you, that grief is like a fingerprint. Everyone's journey is different. But what would you say to someone who is about to enter that journey of hospice, either the patient or the caregiver or both? What would you say to them as far as what they need to remember, like during that process? Who do they need to call upon for their strength?
Depends on their spirituality, you know, their faith. I always tell our families in those moments leading up to one's passing, leave no words left unsaid, no regrets. Make sure you say everything that you need to say. We can educate families on what is happening, and our heads may know what's happening,
right?
But our hearts are never prepared for when that moment actually happens.
Yeah.
And I think I stress that a lot because I don't want them to feel like something's wrong with them or they're going crazy by saying, "I knew this was happening. How come I can't accept this right now?"
Right, because that's kind of normal part of the process.
Yes, absolutely.
I mean, you know, like you said, it's one thing to know it, but it's another thing to go through it.
Actually go through it. Grief is messy.
It is messy. So we do a lovely event in hospice. It's been a tradition for your team for many, many years. It's the Angels of Light Tree of Light lighting ceremony, and it's every December. Yes. So it's coming up. I think the date is December 5th, correct?
December 5th, yes.
And that happens in our hospital lobby. It happens in the evening, 5:30 p.m. And I went to my first one last year. I had a few angels on the tree.
It's powerful, isn't it?
It is very powerful. So can you kind of explain that tradition and what happens there?
I think you explained it beautifully. It's an annual tradition. It's a way for the hospital to bring in the holiday season. But it's also a way for those who have lost somebody or for those who want to honor somebody to be able to purchase an ornament or a donation for an ornament, $15. That ornament will hang on the tree. Every ornament on that tree, we will be reading those names. So it is a very, very powerful moment for those who have lost someone to be able to have that connection again, to hear their person's name.
Yeah.
light refreshments, beautiful music. It is really, it's my most favorite event that
Yeah.
St. Tammany holds.
It is beautiful, and you do get to grab your ornament after, once it hangs on the tree through the holiday season, you can take that ornament home and hang it on your own tree for years to come.
The ornaments will hang on the tree and the whole month of December. They'll be available for pickup starting on January 15th.
Yeah, so I guess you can go to the St. Tammany Health Foundation website, and that's where you would purchase, correct? And how, that's a nice kind of coordinated effort between the foundation and hospice.
Oh, it's beautiful. The money raised from that goes to the Foundation for Hospice Services.
That's fantastic.
Yes.
Well, is there anything else you'd like to add before I wrap up with you?
Just, to the continued bereavement support, I just want people to know that you're not alone through this process. Losing a loved one it's life-changing. Your world is forever changed. So I don't want anybody to ever feel like they're alone through that.
Well, thank you so much for joining us, and thanks for sharing your experiences with us.
Thank you very much.
Appreciate you. Thank you for staying with us, and we are going to be right back.
Surfing your symptoms again? While the internet knows a lot, it doesn't know you, and it certainly doesn't care about you. Get your primary care from one of our many primary care physicians, doctors, not AI. Backed by a team of specialists at St. Tammany Health System. Same-day primary care appointments available.
Hi, we are back with our last segment of Healthy Living, and I have with me Jean Gobert. She is an RN with our hospice care for St. Tammany Health System. So welcome.
Thank you.
I'm glad you joined us. So we've been talking about hospice and palliative care because it is National Hospice and Palliative Care Month. So let's talk about what you do for the health system. What's your role?
I'm a registered nurse with the hospice department, and I am the admissions coordinator for the hospice department. So any referrals, any consults, they kind of start with me, and then I kind of go through those and make sure the right people are getting them.
So that leads us to what, who needs hospice care? Who's eligible for it?
So hospice care is designed for patients who have a terminal illness with a prognosis of 6 months or less, patients who are no longer seeking aggressive treatment or no longer have options for aggressive treatment, chemotherapy, radiation, patients who maybe are just not wanting to go back and forth to the hospital. That's kind of been their life for the past year or so, and the hospitalizations are becoming more frequent, and that's just not where they want to spend all their time. So any of those patients would qualify for hospice, pending an evaluation, of course. But
right.
Those are the patients, those that just want to be home with their family and get back to living the best that they can without all these hospital stays.
Yeah, so I guess that kind of speaks to our next topic. What are kind of the goals? Once someone is in hospice care, what's the goal?
The main goal of hospice is just to provide patients with the best quality of life we possibly can for whatever time they have left, by managing their symptoms, focusing on their social well-being, physical, emotional. It's kind of all inclusive. We kind of support the patient as a whole and not just the diagnosis. So I would think that the main goal is just to provide them with comfort and let them be with their families.
Yeah, so I often hear people when they talk about hospice, they're like, well, when you go into hospice, you don't get any more treatment, you can't get any more care. So what is the relationship? How does the relationship between one's primary care doctor or oncologist or whatever physician is caring for them in their terminal illness, how does that relationship go hand in hand with your relationship?
So we do actually get that question a lot. We have a full team of staff, hospice staff, one of which is a medical director who kind of oversees all the care of the patients. But if a patient wanted to continue with their primary care physician, just to kind of have them oversee things, they have the right to do that. They don't have to forego their physician. Same thing with oncology or cardiology. They can still have that doctor but the goals change. You know, you're not seeing the doctor any longer for them to come up with a treatment plan for chemotherapy or, you know, diagnostic studies for cardiac disease or whatnot. They're just kind of there to oversee.
Yeah.
But we certainly coordinate the care with them and discuss medications and changes and things, you know, maybe medications they've used in the past that didn't work, and we can communicate that back and forth with the team that they are current with. But, you know, just the focus and the goals change from aggressive treatments, curative treatments, to just more palliative and comfort.
Yeah. So we talk about hospice care. Where does it occur? Because I know that it can occur in your home, and we also have an inpatient
We do.
hospice option for people. So kind of talk about what's the difference.
Yeah, so primarily the goal is always to have your patient or have the patient at home. That's always the goal, if that's feasible for the family. Ideally, of course, we want them home surrounded by their family, their loved ones. We don't want to, we just want it to be as peaceful as it can be for them. So home, if they have a caregiver, if they have family support that can, you know, provide that in the home with the assistance of the hospice team, that would be our first choice or for the patient. Nursing homes, if you are not able to provide in-home care, because caregivers are still part of the process.
Right.
So if you don't have a caregiver that can physically provide the care, we can do this in a nursing home, and we coordinate with the nursing home facility. And then we do have inpatient hospice. That is done at the hospital, at St. Tammany Hospital for us, and that is more for our complex symptom management.
Gotcha.
So inpatient hospice is designed for those patients who require more than we can provide for them at home. It may be increased oxygen requirements that we just cannot get in the home. It may be IV medications because the oral medications were tried and didn't help. But those are the patients that qualify for inpatient, you know, which is a great option because it just kind of eases the idea that what if I can't do this? What if they get into a crisis at home? We always have an alternative. We can always get them to the hospital. They remain on hospice, and we can provide the care for them there.
So how would someone know, I guess, how do you know when you should recommend to your loved one hospice care, or when you, the patient, is ready for hospice care? What are the tipping points for that discussion?
I guess I would say first, if you have any disease process that is a progressive type disease, Alzheimer's, you know, cardiac disease, cancer, of course, if at any there's no wrong time to ask about hospice. There's no wrong time to receive the information. But we do get asked, how do I know? What are the signs?
Right.
I would say if you are a patient who just does not want to go back and forth to the hospital, your stays, your hospitalizations are becoming more frequent.
Yeah.
You know, you're spending more time in the hospital than out of the hospital.
Right.
If you know, it used to be once a year you go to the hospital, now you're going once every 3 months. That's probably the time to start at least getting the information about hospice. And we send nurses out to the house to do informational visits all the time. We schedule that coordinate it with families so that daughters, cousins, aunts, uncles, whoever wants to be present can be present. We send a nurse out to the house to give that information, and if there's no charge for that, so if you're not ready in that moment, at least if in a month something happens, you know, you already have that information. But I guess I would just kind of, you know, if you're just not wanting to go back to the hospital, you're no longer wanting to pursue treatments and tests and surgeries and things of that nature, then I think it's probably worth a consideration.
Right. So, much like Stephanie, I would imagine that you also establish wonderful relationships with the families that you support. And so I guess I want to ask you too, why did you choose hospice care?
I think, you know, I did hospital nursing for many years, and I think it's just so fast-paced. It's just task-oriented, and hospice allows you an opportunity. Number one, you see the patient as a patient, and you're not just concerned about a diagnosis. You get to see them in their own environment. You get to see them as a mom, as a dad, as a brother, and it just, you know, you develop these bonds with these patients, and then it's one of these parts of it's part of life that you know, I think often gets kind of forgotten, and people at the end just don't know what to do. And I just think it's an honor that we get to be there with them and kind of help them on their journey and make sure that they get to pass with dignity and respect that they deserve. So
that's amazing. Well, thank you for what you do. And I talked to Stephanie about this also, the Angels of Light ceremony, a tradition, and this year's event is really special because we are honoring someone who was a part of St. Tammany Health System for about 44 years.
Yes.
So do you want to talk about that part?
About the Angels of Light?
Yeah, and who it's dedicated to this year.
So it's in honor of James Core, who was a board member with St. Tammany Health Systems, and that event is December 5th at 5:30. It takes place in the hospital lobby. The Angels it's for a donation. $15 can be purchased at the gift shop, the foundation. And it's just a great way to honor our loved ones, you know, who have either passed or maybe fighting a battle now, and just, you know, be able to begin the holiday season in such a way to kind of all come together. People who are in the same similar situation, maybe grieving like you know, and so that you're not feeling alone in the beginning of the holiday season. So I think it's one of the most beautiful ceremonies that we do. So
I agree. I love it. So, is there anything else you want to add about this topic or anything else we talked about today?
No, just, you know, phone call away if you're ever in doubt, if you're not sure if now is the right time. There's no harm in calling. You'll likely get me when you call. I'm typically the first person that families talk to, and I'm happy to give any information.
Wonderful. Well, thank you so much for being here, Jean. I appreciate your time. And that is going to do it for this episode of Healthy Living. We'll see you next time.